Hey veterans, Travis Studdard here. Today I want to talk to you about something we see with a lot of veterans, and that is those who are suffering with a low back injury from their military service. And what I want to go over with you right now is the lowest rating possible for a low back disability under VA criteria, and that's at the 10% level. And the ratings criteria for this include, there's a few different ways you can qualify for that 10% rating. One way is with forward flexion of your spine of greater than 60% and less than or not greater than 85%. So again, we're talking forward flexion if this is your spine bending forward. And another way of doing that is, rather than that one range of motion, is a combined range of motion rating or measurement, where they measure your forward flexion, your extension, which is back, and then your lateral flexion and extension, which is again the side to side movement, and then your rotation, which is kind of again rotating your spine that way. So again, if your combined range of motion is greater than 120 degrees and but not greater than 235 degrees total of adding up all of those different measurements, then you would qualify for the 10% rating. Another way that doesn't focus on range of motion is if you have muscle spasms in the low back area, if you have guarding, which is again sort of being afraid to touch it, or worried that something's going to cause pain to you. If you have localized tenderness, if the doctor can palpate where that tenderness is and put a finger on it, then that can qualify you. If it's without abnormal gait, which is again how you walk, or if you don't have abnormal spine contours, so if your spine is not bent as a result of that muscle spasm or whatever it is. So those will qualify you. Another way is a fracture of the vertebrae, and where it causes a loss of height of 50% or more, and that has to be shown with an X-ray. So those are all a few different ways of doing it. Another is under the what we call incapacitating episodes, and we'll look at those in another episode, so come back and check that one out as well. But again, if you have limited range of motion of your lumbar spine, which is again your low back, that area around your waistband up to the middle part of your spine, then you may qualify for a disability rating if it is service connected. So and there's a few different ways you can do that. Your doctor would need to make those measurements and record those in a report or on a VA form, and then submit those as part of your claim. Hope you like this. Check out our other videos, and we will catch you next time. Thanks a lot.